Chapter 13, Segment 1. This chapter is all about touch, and which is used to refer to the sensations caused by mechanical displacement of the skin. And since touch is very broad, for clarity, we're going to use tactile to refer to mechanical interactions, and touch to include the perceptions of temperature change, which are thermal sensations, sensation of pain, itchiness, and internal stimulation sensations. So kinesthesia is the perception of the position and movement of our limbs in space. And proprioception is the perception mediated by kinesthetic and internal receptors, and it incorporates sensory input from locations inside the body. And the somatosensation collectively sensory signals from the skin, muscles, tendon, joints, and internal receptors. So touch is important both for survival, like detecting pain, and fundamental actions to identify and manipulate objects. Touch physiology. There are touch receptors are located in the skin, which is the largest organ. Tactile receptors are embedded in both the outer layer, or the epidermis, and the underlying layer, or the dermis, of the skin. So skin has multiple types of tactile receptors that form the basis for multiple channels. So specialized information processing subsystems each contribute to the overall sense of touch. Each type of receptor can be characterized by type of stimulation, which is how the receptor responds to pressure, vibration, and temperature change. The size of the receptive field, which is the extent of the body area that elicits a receptor response. And the rate of adaptation, fast versus slow. So fast adapting receptors respond with bursts of action potentials. First when its preferred stimulus is applied, then again when the stimulus is removed. And slowly adapting receptors remain active throughout the period during the stimulus is in contact with its receptive field. So tactile receptors are called mechanoreceptors because they respond to mechanical stimulation or pressure, and they consist of a nerve fiber and an associated expanded ending. So nerve fiber is composed of its axon and myelin. So A beta fibers are wide in diameter myelated sensory nerve fibers that transmit signals from the mechanical stimulation. Nerve fibers of the various types of tactile receptors are assumed to terminate in different expanded endings. So there are 4 populations of tactile fibers in hairless skin. The first is the Messner corpuscle, and it's a specialized nerve ending associated with fast adapting fibers that have a small receptive fields. There's the Merkel cell neurite complex, which is associated with slow adapting fibers that have small receptive fields. The Pacian corpuscle, which is associated with fast adapting fibers that have large receptive fields, and Ruffini endings, which are associated with slowly adapting fibers that have large receptive fields. Each type of tactile fiber is particularly sensitive to certain features of mechanical stimulation. So the SA1 fibers respond best to steady downward pressure, fine spatial details, and very low frequency vibrations, less than 5 Hz. And the SA2 fibers respond to sustained downward pressure, particularly to lateral skin stretch. And the FA1 fibers respond best to low frequency vibrations from about 5 Hz to 50 Hz. And FA2 fibers respond best to low frequency vibrations from about 50 to 700 hertz. So these four types of mechanoreceptors are always working together to inform us about every object we touch. So next is thermoreceptors, which are located in both the epidermal and dermal layers of skin, and they inform us about changes in skin temperature. So the two distinct populations are the warmth fibers, which fire up when the temperature rises, and the cold fibers, which fire in response to decrease in skin temperature, and these outnumber the warmth fibers 30 to 1. Neural fibers that mediate cold and warmth include unmyelinated C fibers and myelinated A delta fibers, so small receptors. So next is the nociceptors, which is where pain begins. So touch receptors that have bare nerve and respond to various forms of tissue damage or to stimuli that have the potential to tissue damage. So the lack of specialized endings can be divided into two types by their nerve fibers. There's myelinated A delta fibers, which respond to strong pressure or heat, and the unmyelinated C fibers, which respond to pressure, heat or cold, or noxious chemicals. So last we're going to talk about the pleasant touch receptors, which are emotional properties of non-painful bodily touch, appear to be mediated by a class of unmyelinated peripheral C fibers, which are C-tactile afferents, or CT fibers for short. So these CT fibers respond to mechanical stimulation in form of slow-moving, lightly applied forces. And these stimulations are hard to isolate because the stimulation of the CT fibers also induces response from the myelinated A beta fibers that respond to general stimulation.